got married in 2016. We always knew we wanted to have kids. We did fertility treatments and had Ellie in 2019. Then started trying again and starting the summer of 2020. Took several years and became pregnant in the summer of 2023. And that was Joshua.
First learned about Joshua on early 2024. Dr. Moss discussed a patient that had a complete atrioventricular septal defect, still as a fetal.
At the 20-week anatomy scan, they saw the big hole and that he would likely have ABSD.
She was referred to me because there was a suspicion that the baby may have a chromosomal defect and a heart defect.
I think in the moment, like when we found out the diagnosis and I finally accepted it, which was relatively quick, I think I just prepared myself mentally for anything and everything's gonna happen.
Dr. Moss's staff put us in touch with Dr. Molinari, and they set up an appointment for us to get a tour of the facilities.
Well, my role in Joshua's care as a pediatric and congenital cardiac surgery, it divides in 2 times. First, on my initial consult, when I discussed the diagnostic, what would be the plan to after delivery, patient would normally be discharged, come back for a complete repair. So I explained the risk, the benefits, and the procedure.
I noticed that he was retracting a lot again. And I took a video, I sent it to Dr. Moss, and I'm like, this doesn't look right. And they did an echo, and I mean, it was deep retractions. So they had to do the PA banding so that so much blood wasn't flowing to his lungs.
Initially, we occluded a patent ductus arteriosus. That by itself was not enough, so we went to another step and we did a procedure that restricts the blood flow to the lungs.
Dr. Molinari placed a band on the pulmonary artery to protect his lungs. And I must say it was one of the most perfectly placed bands that I've seen as a cardiologist of 34 years.
I know Dr. Moss for many years, but just recently, with her addition to our multidisciplinary team here at Holtz, we started to work more closely together. Typically, we delineate a plan of care with a combination of my expertise and her expertise to have the best outcome possible.
Thank you. Thank you for everything. Even in those moments where we seemed, completely out of it or not in our right state of mind, they were there, to guide us and take care of our son along the way, and took care of Joshie, and now he's thriving thanks to all of them.